Hi, Joan. Heather, Jasmine, Felix, and other number.
I know that Pastor May, this wasn't like an ideal time for him, so we can probably just get rolling. So I can call us to order, and then Jasmine, you're recording, right?
Yes.
Okay, cool. And I can take notes on our conversation. Why don't we do introductions first? So I'm Thea Agnew-Benben, one of the co-chairs of the committee. And Heather, do you want to go next?
Sure. Heather Ireland with Anchorage School-Based Health Centers.
And Lori?
Lori Pickett with Alaska Literacy Program.
Oops, where'd you guys go? There you are. Joan?
Hey everyone, Joan Ryan Estee with Enlaces and the Equity Committee, not the Equity Committee, the Healthy and Equitable Communities Unit from the state.
Great. And Carmen?
Hi, Carmen Paredes, Enlaces.
And Felix?
Hey everyone, Felix Vera, Anchorage Assembly.
And Jasmine?
Jasmine Akers, Deputy Clerk and Staff to the Committee.
And the number that ends in 4273?
Hi, this is Nyopoin with Alaska Literacy Program.
Oh, great. Good to have you. That's awesome. Cool. So does anybody want to do a land acknowledgement to get us started?
I can do one real quick.
Okay, great.
Yeah, I don't have it written in front of me, but I can share how very grateful I am for the opportunity to be here and meet with you all on the land of the Dena'ina, who have been beautiful stewards of it for thousands of years, and I share my gratitude for that opportunity. Thanks.
Great, thanks, Laurie. Okay, so our goal today, when we had our work session, probably about a month and a half ago now, we came up with priorities and then we discussed them at our maybe one meeting before the last one. And came up, we really want to focus on working with the Anchorage Health Department and identifying opportunities to really increase health equity through the work of the department. And then we had kind of a close second on our priority, which was really looking at grants and contracting the municipality and trying to remove barriers and make sure funding's distributed equitably. And so in our discussion, we talked about that becoming part of this work that we want to do with the health department. Celeste, do you want to just quickly introduce yourself? Welcome. Oh, she's on a flight. Okay, thanks for joining. That's exciting. Hope you're going somewhere fun. Okay, so I think our first, the thing that I sent out to you all, I thought it would be useful to just get a lay of the land of everything that's in the health department, which this is just from a very external point of view, basically going through their website, which is pretty comprehensive, I think, but it probably doesn't get at like every single thing that they do. And there are some things in here that I have questions about. So we can look at that in a minute, but I thought maybe before we jump in on that, could we have some conversation, or maybe even does somebody want to try and articulate a goal for what we want to do with the health department? Because I think one of our first steps, once our committee is clear about what we want to do, is to try and meet with them. So if we were to have a meeting with them, what would we be saying was kind of our committee's goal for this work over the course of this year? Does anybody want to kind of take a stab at that? And we can just start sort of word salading and I can take notes and then we can kind of craft one from there if that works.
And I don't know if you can see, but Joan's got her hand up.
Oh, great. Go ahead, Joe.
Yeah, so I was thinking, so you know that sometimes when you come to someone's house and you tell them what to do, it's not okay. So I was thinking that maybe we can ask them first, like, what do they need? Like, what kind of like a needs assessment in the sense of like, what do you need help? Because it seems like they have had a lot of issues staffing people, especially in the upper level, starting with the director of the health department. So I just don't want to come and say, hey, we're going to fix all your problems for a committee of the assembly. I think that we should start by asking them what do they need, and this is what we can provide, and then tell them like our goals, like, hey, we really want an equitable how like grants are being done, or you know, things like that. Kind of start like, hey, just kind of like assessing where they're at.
I like that framing of like, what are you already doing to provide equitable services and to provide equitable funding for organizations that the municipality gives money to.
I'd like to ask them also, what feedback are they getting from the community about
Lori,
their-
sorry. I'm sorry to interrupt you. Heather, can you just repeat what you said? Because I got distracted by trying to screen share and I didn't catch what you said. I'm sorry, Lori.
Yeah, and also if you could make that a little bit bigger, like right now it's 100%, which yeah, that's great, a little more legible. Okay, so yeah, understanding what they're doing to provide services and to fund programs in the community in an equitable manner.
Thanks. Sorry, Lori, go ahead.
Yeah, no, I was interested in what kind of feedback they're getting from the people they're providing funds to. Like, in what ways are they hearing from the communities that they're supposed to be serving? And I know that's not asking them ways we can help, but maybe what help they need learning from, maybe I can say it in a different way, but like, what help do they need in being able to hear from the community on how to best serve equitably?
And I'm sorry, go ahead, Lori.
Yeah. I mean, I know that there's lots of things happening that people are giving them feedback about, things around the insurance requirements being too high and the length of the grants being too long and those kinds of things. And maybe we can help as this committee break down some of those barriers, because maybe the health department's like, my hands are in the air, you know, we can't fix the fact that the muni's requiring small community-based nonprofits to meet unobtainable insurance in order to apply and receive grants. And maybe that's something that, like, I see that as something maybe this committee would have power to work with the muni to change within the health department. Is there some way we can get to what the barriers are that they're hearing from the community or are aware of that are impacting?
And I think it's important to highlight that part of the reason why we're focused on the health department isn't because they're not doing their job well, but because the work that they do is so important to the diverse community that they're serving, and that we're hoping to learn through this process to then apply that to other departments.
I think it would be interesting to understand what they think is happening, like what they think they're accomplishing, and maybe our role is to highlight after we gather the information what is really happening, because maybe there is a gap between the programs that they are executing and how they think they are actually resulting in whatever goal achievement when they are not. I mean, that could be it, that they think it's working and it's not.
I'd love to learn like a little bit of a history. Have services really gone down over time, or have they increased over time, or just like really understanding that, and if they have any sort of strategic plan or something in place about their hopes and dreams as a department about where they're headed, or if that even exists within the municipality. And I know we're supposed to be positive, but it's really hard at this moment in time. I mean, I can't tell you how many people have reached out about difficulties they're having within the granting process and that we too suffer from. So I don't even know if I'm a neutral party in this.
And I don't think the goal is for people to have to be neutral.
Okay.
Like, I think our goal is to be fair and to be helpful, as you're saying, I mean, and to kind of align and find common goals. I think that's what Joan was saying in the beginning, is like, how do we understand what they're trying to do and help them do it better? But I don't think we have to be neutral.
But it is hard when we're some of the people that are receiving, or some of the organizations that are receiving the funding from them, to, kind of puts us in an awkward kind of position. But I think an important one, because we know where it's coming from. But
yeah.
I also wanted to point out Celeste's comment about the reimbursement process being harsh, and I think, and correct me, Celeste, in the chat, but like, we received a grant from them, but we have to spend the money before they give it back to us. So fortunately we have reserves that we can do that, but some grants they give you the money up front.
Mm-hmm.
Thank you.
And I think some of it is understanding, where are these requirements coming from? Sometimes they are associated with if it's state money or whatever, but sometimes if it's alcohol tax money, for example, where's it coming from? Where's that requirement coming from?
I would say that you have a great point, because, for example, there's money that the state, they have to invoice the state for them to get the money, for them to give it to the nonprofits, for example. But then, as you said, there's the alcohol tax. The money is already there. So there are different ways on how the health department has money. And even though the avenues for those monies are different and they have different requirements, they're not all the same. So it's not that everything is in the same stack. Even though the people who apply for that money, we don't know. The revenue monies come from different pockets. I definitely understand how the reimbursement process is awful. But for example, for the equity grant, it comes from the state, and that's how it is, unfortunately. And I know that is super unfortunate.
But I still think, are there policies that could be changed that when there's a reimbursable grant from the state, that maybe the muni does take some of the risk and says, we're gonna use funds from another source to forward fund this, knowing that we're gonna get reimbursed.
Right.
And then
yep.
and then they're taking that risk off of the grantee.
Right. Yep. Absolutely.
Hi, Pastor May.
Hello there.
How are you doing?
I'm doing well. How are y'all doing?
Doing good.
I had issues getting in here, but I'm in, and I hate I had those issues because, as I forestated, I'm gonna have to leave probably before y'all done.
We started off by trying to kind of brainstorm what our goals were for the conversation with the health department. And can you see my screen?
Yes, I do.
Okay,
A-
cool.
and-
That's what we've kind of come up with so far.
Okay.
And I-
So all of those things have come up in the last few minutes, or was
Yep.
this something?
Yep.
Oh, okay.
Yep, this is just notes from what people have said so far.
Okay.
Hi, Panna. Hi, Taylor.
Hello.
And I think someone was also about to, was that you, Joan, or someone was about to jump in? So these are maybe a lot of these so far are related to kind of the how. I'm wondering, do we also have goals related to sort of the what? And that was why I went through and did that, and we can look at it in a second, but just kind of did that review of all the things that are within the health department. Do we have specific goals for our work with them that more relate to the actual content of the program? Like, we would love to know if, the clinic could serve more people, or we would love to know if the childcare, one of our meetings, we talked about childcare licensing and how does that really, who is able to get licensed and who isn't. Like, do we have any goals or questions that are more related to the programs within the department?
This is Nyoboing. Can you hear me?
Yeah. Go ahead.
Yeah, so I don't know if this is getting to your question, but I'm curious around, I know in the past that the health department has been known as a place that people can go and get things like immunizations done. But maybe the last couple of years, there's been a lot of questions on, like, do they provide those, and like, who's eligible to go, and how do you, how are those services covered? And then I have another question around language services, or just outreach. For example, we recently got an overview from WIC on just how everything is online now, and there's this form, and one hiccup is there's no way for a person to indicate that they need an interpreter when they call the person ahead of time, or like in that communication stream of, setting up like an intake call. So I'm just curious, what services they're currently providing and how they're promoting that language service. Oh, I have a call coming in. Sorry. I don't know if I got cut off there.
No, you're here. That's great. Okay. Yvonne, if you can, you also mentioned about the intake and the processes going to online processes. Is that a good thing, a bad thing? Does it create other hurdles? And if Yvonne had to go off, Lori, do you have any input on that?
I think having options is good, but when people, for some people, online is better, but it isn't necessarily better for everyone. And to me, what I would envision the health department is that, people could walk in and there would be navigators helping them apply for a childcare license, apply for SNAP, apply for WIC, that are readily available. Like public health, community-based workers that are prepared to provide language access. It also seems to me to be like a place where when we get a communication from the housing community that says we've moved online and if you need translation, you need to look to a family member or friend for that as their language access plan. The health department to me seems like that should be the place that we should be able to go to say, hey, you know, you're funding this or you're interacting with this, you're taking a lead on housing, you need to advocate for this community. And so I can say that for the online, we've just had mixed. Go, good, Naboyne, are you still there?
Yeah, sorry, I'm back. I was just going to add, so when they were, you know, explaining the forms, and I'm not picking on which in particular, but it was almost like a family had to, you know, fill out 3 different forms. And, you know, in my mind, I'm not a tech person, but isn't there a way to eliminate that burden of having to, right, fill out not only, you know, this one form, but 2 others, and just thinking about the navigation of that. And one thing that they mentioned and that they asked us is, you know, how can we get more eligible families into the WIC program? And well, I think one barrier is there's a lot that has to happen to get them into the door. And it makes me think, and I know that the health department offers a lot of other services, not just WIC and the clinic, but is there a way to streamline things so to identify, okay, if a family needs some immunization, they can do that, and maybe they can indicate that they, you know, need these other programs that the health department offers. And as I see it now, that's not, you know, the case. It's almost like you learn as you go. So I don't know if that makes sense at all.
I think it makes a ton of sense, because when I was doing this exercise of looking at all the things that are on this thing I sent out, I was thinking that. I was like, oh my gosh, like, how could we put these things together? So, Hannah, go ahead.
Yeah, just to add to what was just said, is there even a comprehensive list of what the Anchorage Health Department truly offers in real time? Not what's on paper and what they're supposed to offer, but what is truly available. Because from a school nurse perspective, we are stumped because we don't know where we can send families for X, Y, or Z. And we have not been able to find a comprehensive list of all the services from the 1st floor up to the 4th floor that the Anchorage Health Department will offer to the community. Is there a list somewhere?
Well, that's kind of what I was trying to do, I guess, with this document. And it was, all of this information I got from their website. So, I just kind of clicked through it and tried to take notes. But yeah, I
Thank you,
don't.
Thea.
Yeah,
the website is not real time and it's not reality. The website is what they're supposed to do, but
Yes,
when we send families there, that is not what they're experiencing. So
I hear you.
is
Yeah.
there a way to honestly assess if I send a family of 5 for X, Y, or Z services, what are they going to get?
Yep.
Because immunizations is a huge piece and the Muni has failed. And so school nurses have taken on that task. But we send families there for free immunizations, allegedly school required immunizations, and there are tremendous barriers, language being just the tip of the iceberg. So is there some place where we can find the truth?
and I believe Felix has his hand up.
Go ahead,
Hannah, I
Felix.
wish I could
Oh.
answer that question.
Yeah, thanks. So I don't know if this is going to give you all of the information that you're looking for, but I think it's probably a good place to start. So in the chat, I put a link to the Health Policy Committee's website. And the Health Policy Committee every month gets a health department update that does give you sort of real time what the health department has been doing, and gives you some good statistics and numbers. So again, I don't know if that's all of the information that you're really looking for, but I think it's a good place to start to give you some kind of picture.
Thank you, Felix. Is that a link in the chat that I can then share with ASD nurses?
Yeah, it's basically goes to the Muni or to the health commit, sorry, the Health Policy Committee webpage. This is what it looks like. I just opened it.
And yeah, the link is in
Okay,
the
thank
chat.
you.
And I have listened to these reports, and it is very much a list of like outputs. So it's really a list of their activity. And oftentimes when I'm listening to it, I'm kind of like, okay, you know, I'm not being facetious, but like, so what? Like, what is it doing? Like, is this a lot of activity? Is it not enough? Like, it's not really linked to any kind of goals. At least I've never, and Felix, do you have more thoughts on that? Like, is there a strategic plan or something that this kind of fits into?
As far as I know, to directly answer your question on strategic plan, no, I don't know if the health department maybe has some internal goals that they have. So by and large, no, I don't think these are tied to any kind of goals that the health department has. It's just the health department reporting on, I think, as you stated, the outputs.
Okay. Okay, how about let me just switch back. So other goals for our engagement with them?
Did I say being a place of advocacy at all? I mean, we hear so many things about SNAP. I mean, we're talking about WIC, where like even in the grocery stores, the things that are indicated that are available for people who are on WIC are just unavailable. They're always sold out, and there's no way of planning for that that's like happening on a collective basis. And so I know we have low WIC enrollment because WIC isn't working very well, and people give up on it because what you can get is so restricted, and then what is available of the restricted items are often the sold out items of the grocery stores. So you can't just buy eggs with WIC. You can only buy WIC approved eggs, and those eggs are often gone. You can only buy WIC approved cheese, and that cheese is gone. And so I don't see the like Anchorage Health Department becoming really advocating, like pulling together the grocery stores on ordering, sending messages to the community, only buy the WIC approved if you need them. There's like none of that type of thing happening. Just a frustration and asking us to help register more people for WIC. And so if like we in the community-based organizations and those working in the community recognize, hey, there's this problem with the WIC stuff not being available. And I'm just using WIC as an example, it could be anything, anything that they're working on. Who do we tell? Who do we help? Who coordinates helping to solve that community problem? I mean, me telling managers one at a time to order more WIC eggs is not solving it for the city.
But that's where maybe, you know, approaching it from a perspective of like, what issues are they aware of and open to problem solving on? You know, do they know that even is a problem, and you know, getting their perspective before we go in and be like, well, there's this problem, that problem. I'm just thinking strategy.
I know. I should be in better space.
No, I think it's important to acknowledge what they are, and I'm just trying to figure out how to approach them about it in a constructive.
And I feel really that it's not like there's a person there that's not doing their job. It's that it's been an under-resourced for as long as I've known. And so instead of like feeling like we're attacking individuals who are doing their jobs now in a really under-resourced environment, it's more about how do we support appropriately resourcing them to be able to do the work that would really benefit the community and the communities we serve. I know people want more from ALP all the time, and we're just not resourced to do those things. So it's not helpful when people just tell me, we should, you all should do this thing too. So.
Great. Okay, I think that's really good.
Ditto, Lori.
Oh,
Ditto.
okay. Thanks, Toppy.
No, I'm just saying, I agree with what Lori was saying. I also wonder if they do have like some kind of feedback loop, you know, because that's the reason why they're left out. And a community, like there's no feedback loop. Like, you know, how can people just bring, you know, problems that they have straight to them? You know, because if 2 or 3 or 5 people are emailing them about what the struggles are, then maybe like the rest are not just saying anything. They're not saying anything. But I don't know if there's actually any way for them to get feedback or suggestions from folks how to improve their systems so that it's not nonprofits trying to improve their systems. It's actually them hearing from people that they're serving and how to improve their own systems that they have.
Let me jump in for a second and say that I'm not privy to the jump off point and discussion as it relates to this afternoon, but my thought processes are such that we are trying to coordinate how we want to interface with them going forward is kind of where my thinking was, and the information, Ms. Thea, that you sent out was very in depth. But for the short period in my hands, it was a lot to wrap my brain around relative to all that they do, and it's a smorgasbord of things that they are responsible for. But listening to you guys, because I'm not very familiar with AHD at all, and so that's why I'm rather quiet listening to you guys and looking at all of the entry points wherein there seems to be issues is somewhat intriguing. And I guess what I would say is, out of all of those points that are being brought up relative to concerns, community concerns or whatever, and I piggyback on the thought of maybe how do we make some constructive inroads to create some equity points in those operations. So it might behoove us to make a note of possibly 2 or 3 areas that are very important to this committee, and see if we can make some inroads on those entry points and possibly get some movement toward some kind of correction.
I think that's a good segue to maybe look at this massive list of things that they're responsible for, because I think you're totally right. It's a huge list. And I think that's a really good question of like, out of all of this, are there some key areas that are more important than others? I think we've heard about immunizations already and really kind of like access to preventive care. Language access and navigation is really kind of overarching all of these things, but should we just kind of scroll through this and look at it for a minute, and I can kind of orient you a little bit to what I found? And again, like Panna said, this is just from the website, so it may be not current information. But from what I could gather, there's divisions. And I have to say, there's a number of places in here where you know, some stuff's over in this division, some stuff's over here, and you think, wouldn't it be easier if they were together? But maybe there's reasons that they're not. So administration is where the grants and contracts lives, and then they provide that service, it says, to, you know, the whole department. So they're managing and monitoring over 100 grants, over $10 million annually that's going out. And I did put this column here, kind of opportunities for health equity, and just tried to make some notes of things that we've talked about already, or that that just kind of came up as I was going through all this. So, you know, we've talked about the submission requirements for grants, insurance requirements for grantees and subcontractors, reimbursable agreements, and then delays in process. Interestingly, they also have animal care and control. And just stop me if there's things where you're like, yeah, we really want to focus on that.
Yeah, I thought
Yeah.
that was very interesting
I
when
know.
I saw animal control. Yeah.
Yeah. The sexual assault response team, this was interesting to me. I didn't know that they administer this program. It looks like maybe they just pass funding through, but it did kind of make me wonder, is this connected to any of their clinic services? Or, and again, just jump in if anyone's got thoughts on any of this.
I don't think so. I think it's what happens with, or, you know, it's a relationship with APD. When there's a report, like, you know, if somebody's in the ER or something. That's what I think
So maybe they're
does.
funding the teams at the hospitals, local hospitals?
Yeah, but I don't think it has to do with the, like, sexual reproductive health clinic.
Okay. So that's what they have under administration. Then there's housing services. And this one, it does say they administer several alcohol tax funded programs, shelter licensing, emergency shelter plans. And this is where the Next Step initiative is that we learned about. They do have this link to something they call the Little Blue Book that has a whole bunch of resources. Are people familiar with this? Do you use it? It's like a giant resource directory.
Yeah. For housing?
No, this is like all sorts of things. Yep, Yvonne, you said you use it?
Yeah, we reference it.
And that was one of my things I wondered, is it translated anywhere?
Not to my knowledge.
And I can share that we've invested hours and thousands of dollars cultivating our own resources from the resources that are put out, because we have to make them more manageable and usable, especially even around like housing and other things, and to make them language accessible.
Yeah, this even has like description of laws in it. It's actually really comprehensive. I can find the link for you and put it in there too. So then also under housing services, that's the division we're in. This is where the early childhood education and prevention grants go out from. Which is interesting. I'm not sure how that gets connected to the housing division, because they're funding more than that. And then they did offer technical assistance for any organization under 500,000 to apply for those funds. And that was for the previous round of funding. There isn't one. Well, on the website, it says there isn't one available now, but I think there was recently one through the Children's Trust, right, Toffee? Because you have one of those, is that right?
I wish I had one of those, but I didn't.
Okay.
We didn't get it. But we applied.
You applied. Okay. And did you apply through the Children's Trust?
Yes, I did.
Okay. So maybe in the previous year they did it through their office, and then in this more recent round they did it through the Children's Trust. Okay. And then there's Oh, okay, sorry, that's what's written right here. So it's just kind of interesting. They have this alcohol tax stuff under the division they call housing services. And then there's a division called public health division, but on the text on the website, it says it's the human services division. So I'm a little confused by the description. But then within this, it's also a little confusing to me, to be honest, because you have emergency preparedness under here, the safety patrol, and the safety center, which I kind of wonder, like, why isn't that more connected to some of their homeless services? And then, does anybody know about this? Medical ambulance bus? You can go online and see this if you go to this link right here. It's this kind of amazing looking bus that's kitted out for emergencies, for transporting people if there was like a mass casualty, I think. But I mean, it's like this awesome looking bus that it's probably just, I don't know, is it just like stored somewhere? Anyway, it just makes you wonder, like, could that be used for something? And then also environmental health is in here. That's where they do the food safety, air quality, noise. And then WIC and SNAP are both in here. So we're still in public health division. And then Anchorage Opioid Task Force. Is anyone on this group? No?
No, but
Okay.
isn't
Yeah.
there issues where that money's not getting released? I thought I heard from somebody they had thought they were getting funding for that and it's just not getting released.
Right. So it says on the website, there's 58 million in settlement funds going to the state of Alaska, and that the muni will get a portion. And that's how the task force is kind of defining how that money will go. You know, and I don't know, Felix, do you have any more information about that?
That's really all the information that I have. I know we got an email, actually, I think it was earlier today, with a slight update from the task force. But as I understand it, they're still doing their work. I think they were on pause until they actually knew that they were getting the money, and I think they're going to start doing their work again soon.
Okay. I mean, I think already, you know, just in the part we've gone through so far, it's like there's alcohol tax money, there's opioid money, there's WIC and SNAP, there's, you know, other state grant funds, and I'm just really wondering how those funds could be used strategically.
Well, and one of the things that you said came in second place was looking at how the muni is giving out grants and who's receiving them. And maybe that's the focus within the health department we look at, because it looks like, and I wonder, looking at this, if like somebody just assigns to the health department, you must administer this money, and are they getting resourced to really administer that money?
Mm-hmm. That's a great
Because
question.
it's really hard to give out money. It's
Right.
really hard to do it. And if
Yes.
it's not well resourced and thoughtful with the right, people, then that understand, that's when you have to have $1 million of some sort of obscure insurance that no community-based organization can get. Sorry, Thea, I didn't mean to interrupt you. I really appreciate
No,
this document.
I wanted to add that question because you're right. Like, you know, giving out money is hard. Yeah, it's a really good point.
And if
Also,
the goal is to work with the community-based organizations, then there's really only a certain amount of a caseload that an individual person managing those grants can handle to provide the assistance those community-based organizations need to manage the money.
Yeah. Yeah. And I do know that there was a point where kind of one person was in charge of like 70 different, I mean, I think there was a real workload issue going on.
And so then everybody's set up to fail.
Yeah. So then they have something called the Human Services Division. It also has like, it looks like not the right number of, or not the right description in the website, but this is where you have the Aging and Disability Resource Center. So do people access Does anyone on this call use them?
I've called and tried to use them for emergency rental assistance for somebody in a wheelchair, but they'd already met their allotment, so I wasn't able to access anything.
So this is where you go if you have somebody who needs to be screened for, to get on to one of our Medicaid waivers, where you could potentially get assisted living and other types of benefits that ADRC does the whole assessment process. And that's usually for people who are seniors or people living with disabilities. Does anybody access them for that?
I know we did for one of the
Yeah,
community
we
members that
have.
was at, yeah. That was at Providence, and so, and they worked very well, so.
Okay, great. So, and Taffy, were you trying, I was wondering this about other languages as well, like were you able to get language access there? Or maybe that wasn't necessary?
So what, I think the reason why we were connected with them is that they were already at a hospital, but the community health workers at the hospital were not able to do any work outside of the hospital area, of the hospital.
Yeah.
And so the community health workers there contacted our community health workers, and then we were able to actually do the outside of the service provider, kind of services. And then we were able to connect them to that service that they offered. And yeah, it was pretty straightforward when we were, and
Great.
the community member was able to actually go to Seattle to complete their procedures, and then got back and not be homeless when they came back. We were
Awesome.
able to support them. Yeah.
Great. And Yaban, you were gonna share?
Yeah, no, I'm just saying we have worked with ADRC and have referred people, and they're very good about providing language support. So,
Okay.
Yeah, they're pretty good.
Great. That's good. Okay, cool. I do kind of wonder, they're dispersing the Emergency Solutions Grant, which is a homeless prevention pot of funding. So, and that's also how you can get utilities assistance, is through this same division. And then they are putting data into HMIS, which is the Homeless Management Information System. I just wondered, people who were kind of what you were saying earlier about navigation. It's like people then also, must need WIC and SNAP and other things that they might be eligible for. So are people getting connected? And especially because they're in different divisions, it just made me wonder, like, how does that working internally? And then also in here was childcare licensing. And that was another thing that had come up in one of our committee meetings. Are people connected with childcare licensing? Do you know people who are trying to open childcares who need licensing? Like, how's this working?
I can share. Navoin, are you? Yep. Are you going to share?
Go ahead.
Well, the only
for
thing
it.
I'll share, and then you share your story, is that there has been work done. It was led by ISSA over at RAISE, but CSS and ALP recently testified for Senate Bill 233, I think, that Forrest Dunbar had brought. And then he withdrew it because the state has agreed to remove the requirement for a GED or high school diploma in order to engage with the child care reimbursement program, which was one of the biggest goals we were seeing within the immigrant community, was getting either credentials transferred from another country or completing that in this country. So that's one barrier that will be removed, but they were really good about enforcing that requirement that is my understanding, was an optional requirement anyway, but it's being removed.
So for anyone to start to become licensed at a childcare provider, you had to have a high school or GED? Yeah.
Well, so the claim wasn't that you had to have it to be licensed, but in order to engage in the child care reimbursement piece of it. So you couldn't provide care to anybody and be reimbursed for it through the child care reimbursement program if you didn't have a high school diploma.
Gotcha. Okay. Even if you were licensed.
Yes. And because you couldn't do it that way, that prevented people from getting licensed. And it put forward the assumption that people needed that to become licensed. So it was a perceived barrier that was enforced, even though it might not have been in statute.
Yeah.
Naboyne, is that accurate?
Yeah, and what I can add to the child care licensing, it's just a really complicated process. And one thing that I see is there's a lack of support from filling out the forms, from following, you know, the steps and all of the complicated language that goes into it. And then once someone becomes a child care licensing provider, how do you maintain and still receive really technical assistance in making sure that you're in compliance? So we've, you know, I've worked with a few people in the community who wanted to open up their own, you know, even their homes to do childcare, and it's just such a complex process.
Yeah. Great. Okay.
And there's no language support, or it's not upfront.
Yeah. Yeah, and it wasn't clear to me, and I guess I didn't realize this, that for childcare assistance, so there are 3 different versions of it. One, if you're on a TANF program, one if you're transitioning from it, and one if you've never received it. And again, I just had the same question of like, how is this coordinated with WIC and SNAP? Because if you're on WIC or SNAP, you might need this too, right? Does anybody know if that coordination happens?
We see very little coordination.
Okay. And then there's this community safety and development program that really has the HAND Commission, and then develops the housing action plan. And if you go to these links, you can see the most recent version of it. There's also an interesting, this home, let's see, one of the things on here, this home partnership, the current document that's on there is all, and Felix probably is deeply involved with all this, but it's all around mobile home parks and making them more. Felix, are you involved with this?
So I'm not directly involved with it, but I am familiar with the program and the work that it does.
It looked cool. I also just kind of felt like, you know, how is it interacting with all these other things? And then there's the clinical services division, which looks like it just oversees the clinic. But again, you know, how are those services connected? It talks about substance misuse, but I wasn't quite clear on what's happening there. And then someone just mentioned this about billing. It says, you know, they're not in network with any insurance. It doesn't really say if it accepts Medicaid or Medicare, and it talks about sliding scale. Does anybody know what it, you know, what's the cost for getting services there? It does say no one will be turned away, but then it has other language that makes you think that you will be billed.
The STI testing stuff, I believe, is free, according to their website that I was looking at last week.
Okay. Does anyone know if primary care is available there? I mean, it says cancer screenings, birth control, sexual health, immunizations, STI.
I think by cancer screening, it's like HPV cancer, not all cancers. So
Right.
I don't think it's primary care, but I could be wrong.
Okay. And then I was wondering too, it says there that they can do mobile COVID-19 clinics, but it also made me wonder if that was connected to people who have the Healthy and Equitable Communities grants, which are some of which include COVID testing and immunization.
Can you say that last part again?
I guess what I was wondering is the department's administering the Healthy and Equitable Communities funding, which is to address like the underlying causes of disparities related to COVID. And some of the proposals include like actually doing COVID testing and vaccine clinics. But I wasn't sure if those grantees knew that they could get the mobile clinic from the Muni. Because I know some of them are paying others to do it.
Yeah, we have like our diversity health fair in January. They came to that, the health department clinic, and I think there was one more other event. So I know that you can request it somehow.
And I don't think they have funds from the Health and Equitable Communities units from the state. I think all that funding went to the health department, not the clinical service division.
Say that again, Joan?
Yeah, that the funding from the state went to the Anchorage Health Department, not the clinical service division. So I don't think that they have funding from the Healthy and Equitable Communities.
But couldn't the AHD just allocate it to that division?
Just to the grants, and they also allocated funding for Anchorage Neighborhood Health Center for the mobile clinic.
Okay.
For the mobile clinic that they have, that they go to for different shelters to provide services. So no, they didn't give money to the clinical division.
Yeah, I guess what I was more wondering is, and this is just a sort of global thing, is like, how are they leveraging different parts of their organization? Like if they are doing that through the clinic and they know the grantees are going to want that, couldn't they make it available even though it's not directly funded by the same pot of money? It sounds like from what Neobone is saying that if you know to request it, you can get it. Yeah. Okay, oops,
there's a process in place, and but you have to plan way in advance. I think there's a capacity.
Okay, cool. Okay, we're actually at time right now, and we have our regular meeting on Thursday this week. So if I send this back out to all of you, do we feel, so I know we have some other things on our agenda, but we also can spend a little bit of time thinking about what next steps we want to take. Do we want to have another sort of small group meeting, or do we want to just start the conversation with the health department? Are people comfortable having that conversation at our meeting on Thursday? Pastor May, I'm not looking at the agenda right now, and I think we had that on there, right?
Yeah, I wasn't looking at it either.
Okay, I'm pretty sure it's under unfinished business.
Yeah. I know we had the alcohol tax thing on there.
Yeah, that is happening as a kind of presentation discussion.
And we had on there this was supposed to be a prelude to what we did in the regular meeting, as far as getting a jump start to where we would be headed. And I guess we were supposed to make some kind of have some kind of finality about it in the meeting on Thursday.
Okay, great. Okay, anything else we should cover before we end? Jasmine, do we need to ask for audience participation?
No, it's a work session, so it's
Okay.
up to you.
Great. Okay, if nothing else, we'll see you all on Thursday.
Thank you, Thea.
Thanks for being here.
Yeah. Thanks for all your time to put that document together. It was very interesting.
Oh,
I learned
good.
a lot.
Yay. Okay, hopefully we'll keep using it. Okay, bye.
All righty.
See you Thursday.
All right. Likewise, guys.
Bye.